Good evening, everyone. Thank you so much for joining us today. Um, just want to ask the POA, can you just confirm that you can hear me because I'm speaking from my phone? Okay, cool. Thank you. So welcome everyone to our session for interview preparation for the medical science. Um, just a reminder for everyone to please mute yourselves. At the end of the session, we will be having a Q&A where you can either type the questions in the chat throughout the meeting, or if you would like to, you can ask your questions using your microphone. So we're going to start the meeting off with a very short intro to the internships, the application process, and what to expect from your training. If you don't already know me, my name is Drew, and I am currently doing my internship at the University of Pretoria in chemical pathology. And I also volunteer here at AIMS, helping with communications and social media. So I just want to start off by going over the different laboratory professions, just so that we know where the medical scientists fit into everything. So in medical labs, we have a few different professions. We have medical lab assistants, which usually complete a 1-year certification, and this is often done at private labs. And this doesn't require any university training. Then we have medical technicians, which also do a certification for 2 years, and these can be either from matric or they have started accepting BSc graduates now for this as well. Then you have medical technologists, which are now being phased out, which they used to complete the diploma in biomedical technology, but now this is being replaced with medical laboratory scientists who complete the Bachelor of Health Science honors in medical laboratory science. So this degree is accredited by the HPCSA, which means that they can register once they have finished their degree. So with medical scientists, obviously our BSc degrees are not accredited by the HPCSA, which is why we need to do the 2-year internship. So this is the HPCSA accredited training in order to work in the medical lab. And it acts as sort of a bridging between doing your BSc and being able to work in the medical lab. So this is a 2-year internship, and the minimum requirement is an honors degree, as you know, if you had applied. And then lastly, you have the pathologists, which are medical doctors who have completed their M.Med as a registrar in pathology. So briefly on the route to medical scientist. So medical scientists is a term that encompasses medical biological scientists, as well as genetic counselors and medical physicists. So in this session, we will mostly be talking about medical biological science. So you have the different, the HPCSA calls them categories, but they're often known as disciplines. So you have anatomical pathology, clinical biochemistry, hematology, genetics, molecular biology, immunology, virology, microbiology. Less commonly known is reproductive biology and pharmacology, as well as radiation biology. But these last three are not often offered by any institutions, and they're quite rare. And the radiation biology is actually a new category that's being introduced this year. So these internships are offered by the NHLS as well as by private labs. And the NHLS also offers the training for genetic counselors. And then medical physicists are trained in hospitals or departments of health. So we will not really be talking about this because we are mainly focusing on the NHLS internships. As you can see, the minimum requirement is an honors. For genetic counseling, you need your first year of MSc in genetic counseling. So just very briefly about the different disciplines, just so that you have an idea. So clinical biochemistry, which is what I am training in, which is also known as chemical pathology or clinical chemistry. This involves measuring biochemicals for the monitoring or diagnosis of disease or treatment. This includes metabolites, hormones, proteins, vitamins, minerals, etc. And we look at things like liver, kidney, thyroid, and pancreatic function. Examples of measurements we do is automated analyzers, HPLC, LCMS, GCMS, TLC, electrophoresis, ELISA, and a lot of departments also use molecular biology techniques. Hematology is the study of blood, blood cells, and blood disorders. A few examples include blood cell count, hemoglobin, and cell morphology. They can study things such as anemia, cancers, markers of infection, as well as genetic disorders. And they use flow cytometry, microscopy, immunoassays, HPLC, all of those things. Microbiology, it's also known as medical microbiology or infectious diseases in a lot of places. So this is the diagnosis and monitoring of infectious diseases or parasites, including bacteria, fungi, parasites, and they also look at things like drug resistance. They can test for UTIs or pneumonia, various infections, antibiotic resistance, and they use techniques such as microscopy and culturing. And a huge part of it is also molecular methods like PCR and sequencing. They're also highly involved in public health and environmental testing. Virology is similar to micro, but focuses on viruses and viral infections. So they identify viruses, viral load, as well as antibodies, and they look at antiviral drug levels. Examples are HIV, STIs, as well as cancer-causing viruses. And then they have largely the same techniques as microbiology, and they are also involved in public health and epidemiology. Immunology is measuring inflammation or the response to infections in the body, and they often look at autoimmune disorders through inflammatory markers, tumor markers, antibodies, and they look at the different immune cells. They test for infections, for monitoring treatment, inflammatory conditions, as well as cancers. And they can use automated analyzers, immunoassays, ELISA, as well as electrophoresis and flow cytometry. So as we go on, you'll see that a lot of these disciplines have a large overlap, and generally they use many of the same laboratory techniques. So genetics or molecular biology, according to the HPCSA, these are separate disciplines, but largely training is provided in genetics. Molecular biology, I think, is being slowly phased out because a lot of the other disciplines are becoming more molecular biology based. So this involves the detection of genetic disorders or the use of molecular techniques. Examples are prenatal screening, newborn screening, heritable diseases, paternity testing, and even forensic testing. They look at chromosomal disorders and errors of metabolism, and obviously they use molecular techniques like PCR and sequencing, and they also have cytogenetics in some places. Anatomical pathology is the analysis of tissues, cells, and body fluids for cell or tissue disorders. They look at biopsies, cell culturing, flow cytometry, and histology and cytology. And they can diagnose tumors, infections, or different cell disorders. And they also have applications in forensic pathology or autopsies. Then genetic counseling, which we are not going to be going too much into in this session, is the diagnosis of genetic disorders and counseling of patients and their families, including prenatal screening, newborn errors of metabolism, or chromosomal disorders. Genetic counselors usually consult with laboratory professionals and clinicians on genetic results, but they may also be involved in the actual laboratory testing and will know methods such as PCR and sequencing. I wanted to go briefly over the pathology environment so that you have an idea of the place that you'll be working in as an intern. So you have the NHS laboratory, which includes your laboratory support staff, your lab assistants, technicians and technologists, and your lab supervisor and manager. Then you have your university department, which is all your students, lecturers, and academic staff. So usually, as an intern, wherever you are training, the NHLS lab will be connected to a university department, which is why on the adverts you see the locations are universities. As an intern, you will work in both the diagnostic lab side and the university side, which is why I put scientists in the middle, along with pathologists who are also involved in both sides. And the lab that you are in might be in a hospital or it might be actually attached to the university department. It just depends on where you are. For example, where I am training at University of Pretoria, our diagnostic lab is in Steve Biko Hospital, which is a bit of a distance away from the actual university. A little bit about the NHLS. So you will have seen on adverts that there was also the NICD and the NIOH, and these are subsidiaries of NHLS. So the NHLS has laboratories in hospitals and clinics, and it's also involved in research and internship training institutions. Their role is for diagnostic testing of patient samples. They train medical scientists, medical laboratory scientists, all of the laboratory professionals, and they also conduct health research in collaboration with universities. At the NICD and the NIOH, they are more involved in, well, they do still do diagnostic testing, but they also do environmental testing, and they're involved in public health, epidemiology, or environmental health, as well as training and teaching of interns and students. So I put this here. This is just an example of a test request form from our lab at Steve Biko, just to give you an idea of the different tests that are done in different departments, which obviously differs depending on the specific lab. Sorry. So you can see there's chemical pathology, hematology, microbiology, and immunology. So the scope of testing for each department will differ. This is just to give you an idea of the routine tests that are often requested by doctors. If you want to look at this later, we will be sharing our slides as well as the meeting recording after the session. All right, so the application process, I wanted to give an idea of what to expect when you are applying. So when you submit your application, it can take quite a while until they contact you for an interview. And this is because different departments have interns finishing at different times. For example, there might only be interns leaving in April or even July, meaning you might only start after that. So they might delay conducting the interviews until a month or two before that. So if you're called for an interview, it could take a month or more to hear feedback after the interview. So unfortunately, this is quite a slow process. So it's important to be patient. After you receive feedback, you could only start your internship after a month or two. Personally, for me, I applied in February of 2023 and I only started my internship in August. So it can be quite a long wait depending on the location. Then once you start your internship, just to remember that you will need to register with the HPCSA as an intern, which has a fee of 551 Rand. So the training program is discipline and location specific, but the basic components of the program include discipline-specific learning outcomes, which includes ethics. So you have to go through ethical guidelines as well as other guidelines for scientists to know. You have to train on lab safety, quality management. You also have to know your scientific knowledge on your particular discipline, which includes attending lectures, seminars, journal clubs, and you have to also present journal clubs and seminars to your department. Competency training is your actual practical training in the diagnostic lab. So you have to be competent in the full scope of testing in your particular lab. And then there's also a research component. So you need to complete a research project and present your findings. And throughout the internship, you'll need to collect evidence of all of these things that you have trained on and compile them into a portfolio of evidence. The periods of training on each component will differ, so it's very specific to where you are placed. According to the HPCSA, you need to complete a minimum of 1 year full-time in the diagnostic laboratory, but this is commonly 18 to 24 months. For genetic counselors, they are busy completing their MSc in genetic counseling, and they would better know what to expect from their training. So when you submit your portfolio, 2 months before you submit, you need to notify the HPCSA that you will be submitting. When you submit, you have to pay a fee of 2,000 Rand. And then once you have received feedback from them and are successful in your assessment, you have to register as a scientist within 3 months. They have 3 assessment cycles, January, May, and September, which means you can submit your portfolio during these times, and this is when they will be assessed by the committee. But you can submit your portfolio 3 months before your internship ends. So what is the role of a medical biological scientist? We have many different roles in the medical lab. So we perform laboratory testing on patient samples for diagnosis, monitoring, and treatment of disease. We have to be able to perform and monitor quality control, maintenance, and quality assurance procedures. We perform validations and verifications of new methods or instruments. We have to be able to interpret lab results and collaborate with pathologists regarding patients. We have to conduct medical research for clinical lab applications or improved understanding of diseases. And we also have to often conduct management, teaching, training, and supervising of other lab professionals or students. Very briefly on the role of a genetic counselor, because it's not my expertise. Genetic counselors, they counsel patients and their families on their genetic testing results and treatment options. They perform genetic research on diseases, treatments, or the prevalence of heritable diseases. They consult with pathologists or clinicians regarding genetic results. In some cases, they do the actual laboratory testing, and they're also involved in clinical research or development of genetic tests, and they conduct management and teaching as well. So I made a slide just with some frequently asked questions, some of them which came from our Google form for this event. So I wanted to briefly answer some of them, but if you have any unanswered questions, you can ask them at the end of the session. So there's the question of whether you can do a master's while doing the internship. So this is a bit difficult because according to the HPCSA, their new rules, as far as I know, is that officially you cannot do your internship while doing an MSc. But this kind of depends on the department. Some places manage to find a way around this. So you will have to speak to the specific location where you want to intern or do your master's. How to stand out in the recruitment process. Obviously, by attending this, you are doing something right. Doing your research on the location you're going to, preparing well for your interview. I would recommend trying to contact somebody in the department. You can go to university website, find the staff members where you want to intern at, try to contact someone and let them know that you've applied and why you're interested and why you would be qualified. It's the question of whether you should do a master's or your internship. This, I think, is quite personal. If you're motivated and you have the means to do your master's, then you should go for it. But if you are looking to get into industry sooner, and if you are able to get a position for the internship, I would highly recommend it because getting your HPCSA registration is highly advantageous. Keep in mind that they are very competitive, and having a master's will give you a bit of an advantage when applying for these internships. Does a degree in biotechnology qualify? Yes, it does. There is a list of degrees that are recognized by HPCSA for the internships, but keep in mind that they will prefer people who have a degree that is more related to the discipline that you are applying to. Alternative career paths. So we're not going to go into this during this session, but in future, we are planning to post content on careers in medical science, other options that you can do. So follow us to stay updated on this. Transitioning from academia to the field is a common question. This is partly why we wanted to do this session, to give you an introduction to common topics that are not necessarily taught in your BSc or even your honors. So our advice is research the topics that we are going to present today, because it will really help you know what goes on in diagnostic environment, and will definitely help with not just internship interviews, but other interviews as well. All right, so I think I might have gone over time a bit, but that is our introduction for our session. I will now be handing over to Puseletso, who is a co-founder of AIMS, and she is a medical scientist in microbiology.
Hi everyone, my name is Puseletso and I'm a medical scientist. I'm registered in the field of medical micro. I currently work at the Northwest University. So my slides are just general interview prep more than because Drew spoke a lot in detail about um, what to expect during the internship, where you're gonna work. It's similar for all sciences and even the hierarchy and how we do things. So my idea is then to present in general some of the things that you should take note of during your CV prep and also preparing the interview. Also in terms of career planning. So Drew, you can put the next slide. You can go to this next slide. So basically, I'm going to start with the first thing, which I know most of you have already applied. If you apply this time and maybe either don't get in, maybe you might see some of the pointers here that I'm going to talk about that maybe you did not either add or you added that were not necessary. And then also this, so also my presentation helps with just medical science in general or just science in general, basically. So it's not just when you apply for the internship as well. That's why I said it's kind of general. So obviously, when you have a CV, you have your personal information that you must add to your CV, your professional summary, your education and certifications, experience, skills and techniques, and your publications and presentations as well. So when it comes to your personal information, you just need to make sure that it's clear contact details, and you are also allowed to share your LinkedIn profile. So a lot of um, students, usually third years, and I get some honor students, or I've even gotten masters, who ask me to review their CVs. I will usually review your CV for free. I might take time to review because I have a lot of inboxes, but I usually do review. But some of the mistakes that I see with CVs in general, when they're also being, when you're asking me to review, and I see is that people will be adding their contact details, like adding their home address, postal address. So some of the things, especially now that we also have the Copy Act, you don't, because of the fact that also fraud can be done with your addresses and your personal information as well. You don't have to add like your actual address of like 31206 something street. You can just add your whereabouts. You can just add Joburg. That's enough if you're in Joburg. If you're in, I don't know, um, Grahamstown, you can just add Grahamstown. So, and then it's good to always add a professional summary, which is a brief overview of your skills and career goals and what you want to achieve. One of the things that you need to do is that they need some of the things that you are sending, the CV that you're sending to whoever you're sending it for that specific role you're applying for. Make sure that that professional summary aligns with what you're applying for. And then also your education and certificates. So you have your formal education, which is your degrees, but then also there's training that you do. Depending on where you want to get into, you can also add like your GCP and your GCLP certificates, your ethics certificates, your quality management certificates, and training as well. You can add to your CV and your experiences. It's good to say and make sure that you tailor make your experience uh, for that specific role that you're applying for at that time, and to emphasize the relevant skills and lab techniques, or if you've been in clinical trials as well, clinical trial work, and then also list some of your technical and soft skills, such as specific techniques that you've done and data analysis and problem solving. So it's good to add those things as well. Publications and presentations. So if you've ever presented and if you've published, add it to your CV, and also conferences that you've attended and you presented. It's always good to add some of the work that you've presented. Well, some if you have a lot, um, but if you do even have one, just add that to your experience as well. Next slide, Drew. So I'm just going to discuss some of the things that we already know also when you have a CV, but also just to highlight on them again. So do I'm gonna start with the do's, right? So do keep it concise, which is 1 to 3 pages, but it can be more. And this is according to the experiences that you've gathered over the years. But try keep it short, especially if you're still new and you're leaving school and fresh, trying to get into the internship. So keep editable formats of your CV. So this is for, especially if you're still trying to get into either the internship or you're not sure where you want to fall into. So always make sure that you have like maybe a Word document which you can edit to follow the specific submission formats or guidelines of a specific company that you're applying to, because sometimes if you're applying to Part K and if you're applying to the NHLS, the formats are not the same. So it's good to always maybe have formats of your CV that you can edit. And then you need to make sure that you have consistent formatting, which comes down to your font, to your sizes and spacing as well. Use active language, but then also, because we are in a, a technical field as well, also add some technical jargon. Just make sure that you don't overuse it, because especially we've had a struggle sometimes when you apply to the NHLS posts, and sometimes they're not sure, because we once had an application that we applied for, then the HR, when asked why they did not shortlist the person, they were like they did not understand some of the things that were written on the CV. So still add some technical jargon, but make sure that you don't, it's not too much. And make sure that you tailor your CV to the job description of the post at that time. So if they've written some of the things that they want, to make sure that if you've experienced in that, you highlight that. So some of the things that you need to avoid is avoid generic CVs. I know that if you go to Google and you go to templates and whatever, try and avoid generic CVs, avoid images or graphics. I know people like to add pictures, but you can add a picture, but remember that you could be, how do I put it? You don't need a picture as a scientist, maybe on your application, but I'm trying to think of the word. You could be also opening a way for whoever that is going to receive your application. Um, if they don't like the picture, they might not pick you. So just be careful when you do such things. Or you add like graphics as well or on your CV, but a straightforward plain CV should be fine. So also avoid adding relevant information, such as your health status. That is not necessary to be added to the CV. I've had CVs that I've reviewed, and some candidates still add ID numbers. You don't need to add your ID number to your CV. Also, in terms of your references, make sure that they're comfortable. For example, if you're going to put them on the CV you're applying for, make sure that they're comfortable that you're sharing, because some people prefer that their CVs maybe don't have references. They will say references, you will get them upon requests, but which is also kind of not, they don't prefer it basically. But make sure that you don't share things that is not necessary on your CV in general. So Like I said, don't add overly technical jargon and abbreviations as well. Remember that HR still needs to see if you are a suitable candidate. Next slide. So basically, you need to make sure that you customize your CV for each and every role that you apply for. Even for the internship, like Drew said, they will take out one post for all the different disciplines for medical science. But obviously, I'm sure if you apply, depending on your degree, if you're still suitable to apply for micro, um, and maybe a genetic counseling post, your CV wouldn't necessarily look the same for both. So try adapt it so that you still fit the description of the role that you're applying for. Um, so you need to highlight your different skills based on the job description at that point. When you're applying for lab posts, you need to speak about your lab skills, obviously, analytical skills when you're speaking, when you're applying for maybe epidemiology roles as well, or GCP skills when you're applying for clinical trial posts. So you need to align your achievements as well with the requirements of the job descriptions of the role that you're applying for. Next slide. And I've already mentioned some of these things. Some of the common mistakes that you need to avoid on your CV is overloading with unnecessary details. Um, so one of the things that also people do is that they don't add some of the achievements that they have achieved. Maybe they don't see them as much. So let's say you have come up with a method in the lab that reduced test errors by 20%. That is something that you can note on your CV. You just need to find a way to write it. So make sure that you add your achievements to your CV as well. And then also using technical terms that may not be relevant or understandable to HR. I've already said that. And make sure that your CV doesn't have spelling errors, because most of the CVs that I go through as well have got spelling errors, and that is not a good impression to leave. Next slide. So now we're just going to go to when you're preparing for your interview. So basically, some of the key tips for effective interview prep. So some of the things I'm sure you already know, but just to emphasize on them again, even now that you, for those who have also applied for this internship, and those you who are going to still apply for other jobs, it's kind of general. So you need to research the organization that you are going into and the role that you are going into thoroughly. You need to kind of understand where you are in the hierarchy of like the lab itself or wherever you're going to work. And you need to review the most common interview questions that are there within our field, which is going to be technical, behavioral, and situational as well. Um, we always like to, especially if you've been to a few interviews, you sit there and you're like, no, it's fine. I don't have to prep this question, such as this the first question that they usually ask you in an interview. Tell us about yourself, until you get there and you didn't practice and you're not sure what to say anymore. So it's good to review the most common questions and then reflect on how your skills and experience are going to match that role. So it's good to go through these things and make sure that you link your skills and experiences to that role that they're advertising at that time. And then a pro tip, something that I always recommend that my mentees and students do: if you do get an interview, please search your LinkedIn, and you're gonna search for even a person who works at the company that they're calling you for an interview for. So I've had people who've searched me and asked me where I've worked, and I still gave them tips. Um, I've also asked people, I've also found people that uh, I was getting interviewed at their companies. No one has ever been rude or said no or anything. Just ask them some of the what the company's like, what they asked during the interview. So LinkedIn is your friend. Next slide. Um, and also sometimes, let's say you don't necessarily find a person who works at that company with in that company, for example, but you can still look for a person who has the same role and still ask them what tips they can give you for the interview as well. So obviously within our role, some of the questions that they're gonna ask you, um, you need to be prepared for all the questions that they might ask you and the type of interview that you might have as well. So the common ones obviously are technical questions where they're gonna maybe, for example, ask you describe a challenging experiment that you did. If you had issues, how did you solve it? Um, Behavioral questions that they ask you, which can be like, how do you handle pressure when you're working in a lab setting? Um, Situational questions where they ask you how would you manage a clinical trial delay, which sometimes are very broad questions. And sometimes when you are in a situation where you're asked a question that is broad, it's easy to panic, but it's always good to remember that if a question is hard for you during an interview, you are allowed to like kind of breathe, kind of think about the question and answer it as so as you become calmer because you kind of panic, but you are allowed to like take your time to answer questions in an interview as well. Um, and also you are allowed to ask for clarity. Let's say you you misunderstand something little, just you can ask them repeat the question, or can you phrase it in another way that I can understand for them to kind of make it simpler for you to relate to the question as well. So next slide. So this is just about when you respond to some of the questions that they're going to ask you during the interview. So you need to try stay concise as possible. Don't say a lot of things that are unnecessary and avoid overly technical jargon unless relevant. Unless if they're asking you what goes into a PCR and what is the function of each and every component, then I mean you'll have to be technical there. So an example that I give you is the question that they almost 99% of the time ask you, which they will say, tell us about yourself. So they don't mean tell us about yourself, tell us about your hobbies, what you like to do during your spare time, if you like swimming or not. No, um, it's you need to think about your academic journey, where you talk about your degrees, your institutions, and your area of study. You highlight your key milestones, which are academic achievements, publications, or significant projects that you've worked in and you did well as well. You need to transition in your introduction. So you basically need to transition to your current goals and connect your past experiences and career interest basically with the role that you are applying for. Just to show that you've linked your experiences and the role that you're going into. Um, One of the things that you absolutely need to do when you're going to an interview is make sure that you know your CV, because you need to be ready to discuss your previous work in detail, including your publications, conferences, and ongoing projects. I have been to an interview where basically my CV was being checked, where they were like, tell us about this publication, tell us about this publication, what did you do here? And they ask you in detail. So always know your CV, always be ready for such questions as well. Show your passion and commitment to the field. Don't be kind of bland when you answer the questions. Show some enthusiasm, you know. And if you do not know the answer, just say so. But if you also have an idea, you can ask to attempt the answer. You can say that, oh, I'm not sure, but I can try answer the question. If I'm an interviewer and somebody says that, it would show that oh, at least they're willing to try, you know, even if the answer is wrong, you know. But yeah, and one of the things that is very important is to practice, practice, practice. So it's very easy to, when you're sitting down, you're like, you know that they're gonna ask you what is your strength. You get to the interview, they ask you what is your strength, and now you don't have a pre-prepared answer, you forget, you go blank. So make sure that you practice even the easiest questions that they're going to ask you during the interview. Also, one of the things that you can do to leave a positive impression during your interview is to ask questions. It shows that you're prepared for the interview. So there are many questions that you can ask after the interview. If they ask you, do you have a question? If you say no, it kind of looks like, yeah, no. Unless if some of the things we discussed during the interview process itself, but it's always good to like ask a question just to show that you're involved and you came prepared as well. And it's always good to smile as well. Next slide. So after the interview, you do have recruiters in HR. Those people ghosting you and you won't see them ever again. It's always good if so. One of the questions that you can actually ask after when the interview is all said and done and they haven't mentioned anything about getting back to you, you can ask, so how long until you think you can give me a response? And then maybe they will tell you a week. After a week, it was good to send a brief personalized thank you and a question to ask. Oh, okay. So you can also send like a brief personalized thank you email within 24 hours. That's fine. But I kind of prefer to send it if I did ask when I'm gonna get feedback and I don't get feedback within the specified time, and then ask that during the interview we discussed that you were gonna reply to me in 3 days. It's been 3 days, just wanted to follow up, you know. Um it's good to reinforce your enthusiasm for the role and appreciation for the opportunity while you're sending that follow up as well. Um and then it just says that follow up on any next steps or timeline provided during the interview as well. Next slide. So, so within our field as scientists, one of the things that I like to say that um, is that because one of the questions that I get a lot is HPCSA. HPCSA, it's not the only thing that you can do as a scientist. There's other career paths that you can follow. And then I just wanted to speak about some of the career development within medical science and then exploring some of the pathways and opportunities. You can move over to the next slide. Don't forget to mute. Please don't forget to mute your mics. So one of the things that I do, even when I have mentees or people that I talk to and they ask me about their careers, is very important within our degrees to plan, especially when you have got those degrees where you're doing BSc biochemistry and microbiology. It's important to plan your career and to think about between biochem and micro, which one am I leaning more towards? So that you start working towards, if you like micro, for example, start working towards making sure that it's a field that you're kind of more specialized in more than your biochemistry, for example. So why do you want to plan a career? So one of the things that is also important when you're planning a career is checking the increase for demand for the different medical sciences paths. So weighing, like I said, maybe between biochem and micro. Also looking at opportunities to specialize or move into interdisciplinary fields. So when you plan, it's good to look at those things and see where you can fit in. Um, and then also, it's always good because when you're planning, you can be able to like kind of design a visual flow chart of the career that you want to follow, um, in terms of some of the entry level roles that you can kind of get in and apply to get into, because some of the roles that you would like to get into as a senior, but then there's, or maybe let's say you want to get into clinical trials, for example, you want to be a CRA eventually, but it's very rare that a person can just start with being a CRA. If you plan your career properly, then you can be able to see some of the points of entry where you can enter a specific career and know that you end up where you want to be eventually. Next slide. So some of the career paths that you can follow within our field, I'm just going to give a brief overview and to just think about where if you're also starting out where you want to be. So I'll just mention them one by one. You can go to the next slide. So where if you want to follow the clinical research scientist path, where the overview, obviously all these are not in detail, it's just something to mention so that you can think about them and maybe note them down. If you're doing a BSc, think about where you think you want to be. So this is where most of the scientists are then conducting clinical trials, work in quality and regulatory settings, data entry as well, and statistics. Some of the required skills within this path are GCP certification, project management, and data analysis. Typical employers are research centers, hospitals, and pharmaceutical companies. So also this, my brief overview will also kind of give you an idea of some of the companies even when you're on LinkedIn to follow. So do follow research centers, do follow hospitals and pharmaceutical companies, because this is where you'll find some of these opportunities. Next slide. And then you have a medical lab scientist path. And then within our context in South Africa, we have the medical lab scientist and medical biological scientist. Drew has already spoken about the difference for us. So this is where you conduct tests in the lab, support diagnosis and treatment of diseases. So some of the required things are lab certifications such as HPCSA and hands-on skills as well. GCLP as well is vital to have when you're applying for such posts. And then typical employers are hospitals, diagnostic labs, and public health labs. Next slide. And then you've got the epidemiology public health specialist path, where their role usually includes studying disease patterns and contributing to public health policies. Required skills, biostatistics, data analysis, and public health knowledge. Hiring employers are government agencies, NGOs, and global health organizations. Next slide. And you have a biomedical research path, which involves researchers researching on disease mechanisms, contributions also to scientific discovery on diseases or treatment as well, mainly in academia. Required skills are lab techniques, critical thinking, and grant writing skills, for example. Typical employers are universities, research institutes, and biotech companies. Next slide. So you've got the biotechnology and pharmaceutical sciences path. Role overview includes development of drugs, improve health technologies as well. Required skills are knowledge of molecular biology, pharmaceutical regulations, product development. Typical hiring companies are biotech startup, pharmaceuticals companies, and research and development departments. Next slide. So if you look at all those that I mentioned, those are all paths that a BSc graduate can follow. So it is up to you in terms of some of the skills that you are developing, um, which to look at where you can follow. So our how can I say, our fields are so broad and there's so much to do. Even if maybe you don't get into the HBCC internship this time, don't get discouraged. Think about some of the paths that I've mentioned, and then try and see where you can also fit in. Some of the things that I like to speak about, even with my mentees as well, is that it's important in our field to make sure that you learn transferable skills in our field. So these can be applied across all our degrees, whether you did biochemistry, genetics, whatever. It's good to always have this thing. It makes you more hireable. So you need to make sure that you have got scientific communication and scientific writing. There's always courses, even on LinkedIn, where webinars and stuff where they're always offering scientific writing, scientific communication. Attend those things. If they have certificates, beautiful. Then you have something to add to your CV. And then also data analysis and statistics, bioinformatics. that is also a field that is opening up now for BSc graduates. Make sure that if there's like scholarships, fellowships that are open to attend those things, attend. Problem solving and adaptability, project management as well. Now you can get project management certificates as well, even for us BSc students. And then also it's always good to do some form of quality management. So within the lab, we have the 17025 ISO standard or 15189. So those are important to have because also those are important points that they're going to ask you during the interview. To depending on the interview that you have, but most likely they always ask probably about quality management. So it's always good to learn those things. Next slide. So in terms of developing a career in medical sciences, the steps that you can take, make sure that you, number one, network with professionals in your field. Like I said, LinkedIn should be your friend. Pursue certifications and additional training. There's sites that offer free GCP, GCLP training. Um, Make sure that you always, if there's like calls to submit, to attend things, always try and attend. Attend conferences, workshops, and webinars. Especially workshops and webinars, you get some of them that are funded and you get certificates to attend as well. Seek mentors, seek people who will help you with the specific career that you want to follow. And obviously you can approach them via LinkedIn as well. And join professional organizations like AIMS, like us. We try and get people, if you want any advice, you can always contact one of our team members and we will try help and assist in a way that we can. Next slide. Resources for your career journey. It's obviously your job boards and internship or portals, sorry, formal introductions to companies or departments. You can email or go in person. Um, I think this is one of the things that is underestimated. If you are looking to go into a department, it's always good to kind of try and introduce yourself even to the people who go there. You can either send an email or go in person just to go see what is it maybe that they do as well. This is such a good tool for you to make yourself known and be remembered. Even when they see your CV, they're like, oh, it's that one who came to ask questions, basically. Relevant certificates, GCP, public health courses, anything, any courses that you can do to make sure that they're leading you towards the goal that you are trying to achieve with regards to your medical science career. Also, LinkedIn groups, forums, and professional organizations. If they're not charging you to join, make sure you join because these organizations share a lot of like opportunities that are there with regards to whatever field that you want to like pursue. Next slide. So I think with my talk today, some of the key takeaways that I'd like to give you is that to think about what we've spoken about is customizing your CV for each role and focusing on your relevant skills, preparing for interviews with research and practice. And there's a method called the STAR method. Just go look it up for when they ask you some of the like questions that they're gonna ask you, such as your situational, behavioral, and questions that they ask you during the interview. There's a method called a STAR method. Just check it out. It might help you in terms of breaking down some of the things that you want to, when you're replying to the interviewer, what are you actually trying to say? Build professional relationships and seek feedback to improve continuously as well. Next. With that, I would like to thank you guys for listening to me. I think we're going to have a Q&A session after this. Um, if you have any feedback as well, or you have any questions, you're welcome, more than welcome. I think Drew will also share our email addresses. Thank you, guys.
Thank you so much. So we are going a bit over time. We are not at the Q&A session yet. So I will be presenting on some of my advice as well for the interviews. For your interviews, as far as I know, they will be conducted online. That's how it was conducted last year, the year before. So in the interview, there's usually a panel of scientists, pathologists, lecturers, or laboratory managers, and they're usually from, well, in my experience, most of them were from the university department and not necessarily people from the diagnostic lab, which is important to keep in mind. And the questions that I'm going to talk about are to aid you to do your own preparation. So please go and do your own research. Anything that I talk about that you don't know much about, please go and read up about them. It will really help you. All right, so this was already talked about. The number one question, tell us about yourself. I'm not going to repeat what was already said, but yeah, don't talk about your personal things. Focus on your career achievements, why you want to do the internship, how you are suited for it. Okay, as I said, um, avoid personal things. Describe your career milestones, where you are, why you applied for the internship, and your scientific background. Okay, so laboratory experience is quite an important part. Make sure that whatever you have put in your CV, that you're able to tell them about and explain to them. Because in my experience, they will ask you certain things, whether about research projects that you mentioned or lab techniques. They might ask you, what is your experience with them? What is the principle of them? Things like that. And they do like to hear that you have experience working in a lab, whether in your degree or any other environment. Again, they might ask you about any research that you have been involved in. It might not necessarily be your own research. You can mention research that you've helped in, whether as an assistant or maybe you were helping a postgrad student or something like that. So you can mention any project that you've been involved in or assisted with. You can include the title and where it was that you completed. Very brief on what did you do in the research? What methods did you use? I think it's important to highlight the skills that you gained, whether it's practical lab skills or data analysis or interpreting of results, things like that. And the interviewers might ask you more questions based on what you have said. So they ask you something, try to answer them and keep the discussion going. So in the interviews that I had, they often asked me, do you have any leadership or teaching experience? Now, I don't think this is necessarily a requirement, but I think it can be seen as beneficial because part of being a scientist is training others, students, interns. You will be asked to present CPD material, even as an intern. We present seminar and journal clubs, and working as a scientist or as a researcher, you could be supervising students or lecturing as well. So you can include anything that might be around teaching or leadership, like being a class rep or on student council, any mentoring you've done or management, if you have supervised research. Teaching as well could be tutoring, if you were a lab demonstrator at university or teaching assistant, and also if you've done any sort of presentations, like in my honors, we had to practice presenting a journal club. So this question, how would you handle a high pressure environment such as the pathology laboratory? This is one of the questions that caught me out a bit. This is less about technical skills and more about how you would handle a stressful environment. So you can mention any skills and take from your personal experience as well. How have you handled stressful environments, which we all have in our degrees? So, organization, time management, communication, leadership, planning, keeping a positive attitude, the ability to work with others as well as independently. And you can even give an example of situations where you've had to use these skills. So they will probably ask you, what are your strengths and weaknesses? And I think a mistake people make is to only mention strengths. I think you should mention weaknesses that you have, but try to explain how you are improving on them. For example, I can be a quiet person. I don't speak up much. I don't talk much in conversations. So I said, this could be seen as a weakness, but I'm improving on it and trying to participate more. And yeah, it just shows that you're being honest and not just trying to portray yourself as having no flaws. So they will ask you, why do you think you're a good candidate for this internship? This is when you can say as much as you want to, in my opinion. Often they ask you this at the end of the interview. State why you are qualified, skills that are relevant, why they would benefit from what you have to offer, how your interests and your goals align with the internship, and also state how the internship would benefit you professionally. A few other possible questions they might ask is there a particular field of research that you're interested in? Why you want to do the internship? Which discipline or location is your first choice? Often the HR representative in the interview will ask you this for HR purposes. The classic, where do you see yourself in 5 to 10 years? This one, I think you can take a little less seriously. I think they just want to get to know you as a person and where you would want to be in the future, but try to, contextualize it as you want to do the internship because you want to be a scientist and, where you want to work one day. They will also ask, how would you handle conflict in the work environment? Again, this is similar to the other question about handling the high pressure environment. Give examples of situations where you've handled conflict. Then some general tips. Keep notes with you during the interview to help remember what you want to say. This was essential for me. I had 3 interviews at different places, and by the 3rd interview, I knew exactly what they were going to ask me, but I still wrote down every possible answer. I practiced saying it. I made sure I was prepared. I kept the notes with me on the day to look at because it was online and I was able to keep them next to me. Do whatever you have to do to be prepared and make yourself less nervous. Make sure you have a good internet connection beforehand. Make sure your video is clear and your background is clear. be punctual for the interview, dress professionally. You don't have to dress super formal, but obviously don't be sitting in your pajamas. I know it's online, but make sure you look decent. Be honest about what you don't know. This is important because, yes, you can try to attempt to answer some questions, but don't try to fake it. Be professional but friendly. And as I said, practice saying your answers beforehand. Then I wanted to mention some questions to ask the panel. Again, you can write these down because in my experience, I would have forgotten if I didn't write them down. You can ask them anything that you are genuinely interested in, but if you need some ideas of what to ask, you could ask them what opportunities are available in that department for research. What are the main research areas of the academics there? What kind of lab skills will you gain from the internship? Because different labs will have slightly different, instrumentation and tests available there. What are some of the daily expectations for an intern? Is there a high success rate in finding employment, or what are possible employment routes after the internship? And what would be your role as an intern in the lab and the academic department? In the interviews, they often have a list of the same kinds of topics that they will ask you. So this is where I'm going to cover these. So they could ask you about good clinical practice or good laboratory practice. And this is important to know when you're working in a medical clinical lab setting. In my experience, it didn't seem like it was necessary to know, but I think it's important to show them that, you've researched these things and understand the principles. So as Puseletso said, you can complete courses and certificates, do your own research. Just make sure that you know the basic things. Okay, I'm not going to go over this because we are over time, but we will be sharing the slides after the session. This is just a summary of GCP and GLP. They will ask, well, they could ask about internal quality control. Try to familiarize yourself with the concepts and examples and how it is used in a lab of your discipline. They could ask generally, what do you know about IQC? Or they could ask you any random specific questions. For me, I was asked, what is an internal standard? And that was the question that they asked me. They could ask you what knowledge do you have on quality assurance in a pathology lab. So they want to see how much you know about pathology labs. They're not trying to catch you out, but it's good to revise beforehand on things like quality management systems, quality assurance, performance indicators, accreditation and audits, EQA programs, and standard operating procedures. Okay, they might ask you about SANAS. They asked me who accredits medical labs. So SANAS is the South African National Accreditation System, who perform conformity assessments and regulate many different sectors, including medical labs and industry. As you can see in the image, they are responsible for accreditation of labs, and they also have people who perform regular audits on these labs. They might ask, do you know what accreditation or auditing is? Accreditation is recognition of a lab's competency to perform patient testing and provide results. And it can be removed if the lab is found to no longer be competent during an audit. Audits are when they assess a lab's performance and identify errors or non-compliance to regulations. And you can have internal audits, which is within an organization, or external audits, which is when SANAS conducts the audit. And they use the ISO regulations 15189, which is also known as the International Organization for Standardization, which I think is also an important thing to know for the interviews. They could ask you about method validation. So you can revise on method development, method validation, verification, the difference between validation and verification as well, and which guidelines are used for these processes, such as the CELSI EP guidelines. And they could ask you any sort of specific questions like, what is limit of detection, limit of quantitation, sensitivity, specificity, all of these things. Again, just an example of something that I have explaining the difference between validation and verification. If you want to go look at that. They could ask you, do you have experience with statistical techniques and data analysis, which is an important skill both for research and in the routine lab. So you can tell them about courses that you've done, either in your degree or in your own time that included stats or data analysis. You can tell them about how you analyze data in your own research and any specific statistical tests that you used. Again, they might not ask you generally about stats. They could ask you a specific question during the conversation, like, what is the difference between analytical range and reference interval? What types of data have you worked with? What kind of softwares have you worked with? A reminder that whatever you have in your CV, make sure you can explain it. If you say you've worked with R, make sure you can tell them about it and how much you've worked with it. Another important question, how would you troubleshoot? Troubleshooting is an important part of medical labs. You need to be able to identify errors and determine their source. And it's really important when you're dealing with patient results. You can use your own knowledge and experience, draw on your own examples. You can also use the root cause analysis approach, which is what is commonly used in labs. Define the problem, collect data around it, identify possible causes, perform checks or corrections to find the root cause, and then implement solutions. They could ask you specific troubleshooting questions like, how would you handle contamination in a test such as PCR? This is important for those in micro, viral, genetics. It's quite a common question in molecular fields. They will ask about things like these. Some other possible questions, they could ask you about lab safety and hygiene, your basics on working in a lab. What do you do when you enter the lab and start an experiment? You mention, lab coat, washing your hands, cleaning your bench, wearing gloves, etc. They might ask you about biosafety cabinets, when they are used and for which pathogens they are used, explain sterile technique, explain the different types of biohazardous waste. Again, with hygiene, what is the correct order of PPE application, N95 masks. They could ask you what is the correct way to store specimens, or how to store laboratory chemicals or reagents. They might even ask something like, well, I was asked, do I have experience using liquid nitrogen cylinders? What are the different types of fire extinguishers? Or what is the correct experimental workflow to minimize contamination? These are just some examples, but I'm sure during your degrees you have learned these principles of lab safety, but just keep in mind to keep up to date with your knowledge. Some other topics to revise. Importantly, research the lab you want to intern at. Research the discipline that you applied for. What tests do they do? What lab techniques do they use? Again, what was said before, try contacting someone, whether on LinkedIn or directly someone in the department from the website. And again, this will also show your interest in working there. For micro and viro, you can look for what pathogens they test for. Do they use molecular techniques, or is it more microbiological techniques? What sort of instrumentation do they use? Similar thing for immuno and for chempath. For chempath, depending on the lab, they might have different tests that they do. For example, where I am, we mostly do general chemistry. We have some specialized tests such as electrophoresis, but somewhere like WITS, they have general chemistry, but then they have their specialized lab which does mass spectrometry as well. And again, know how to explain any lab technique that you stated in your CV, because they will be looking at your CV during the interview. Very briefly on chempath. So, as I said, depends on the lab, but most chemical pathology labs do the basic chemistry tests. So under common tests, we have urea, creatinine, electrolytes. I'm not going to go through all of them, but we test for diseases like diabetes, metabolic problems, heart disease, cancers. We monitor drugs as well as toxicology. We look at nutrition like vitamins, acid-base disorders. Through electrophoresis, we can look at serum proteins. We also do endocrinology, so looking at hormones. We test for renal and liver function and thyroid function. And then there's also metabolomics and proteomics, which is in more specialized places. All right, thank you so much. If anyone has any questions that they want to write in the chat for now that we can answer, please go ahead. We also have Tapiwe and I think Anele is also with us from AIMS to help answer any questions. Is there anyone who wants to go ahead and ask with their microphone? They can put their hand up.
Drew, can you hear me? Can I try and answer a few questions from the chat?
All right, yes.
The one that I see here is registering with HPCSA a requirement before you consider going for an internship. You register with the HPCSA during your internship as an intern. That's when you start with the HPCSA registration. That's the first question that I see there. The other one I see is how long do interviews last per individual? I think it might be departmental, it might be department specific, but you can spare some time for something between 15 to 20 minutes. It can go to 30 minutes, but mostly between 15 and 20 minutes. There isn't a specific time given for interviews. Those are the questions that I could find on the chat. Not sure if other people have questions online.
I am seeing some other questions coming through on the chat.
Can you apply for internships on the year you're still doing your honors, or you can apply after obtaining the qualification? It is ideal to apply when you have the qualification, but if you will have your degree um, by the time you go for interviews and by the time they want you to start, then you can apply. But it's best to mostly contact HR and hear what they say. Where are these internships advertised and around what time of the year should we be on the lookout? Drew, can you help with that? I forgot, but some we saw on LinkedIn and other places.
So there's no official time for when they advertise. Um, it just kind of depends when they decide they have enough posts to advertise. So recently, the adverts were sent out in November last year. So unfortunately, if you missed that, it means it could be another year before they advertise again, because obviously the internship is 2 years and they have to wait for enough interns to be leaving to advertise posts again. The adverts are usually uploaded on the NHLS careers website, but as you see, these were circulated on LinkedIn. But just keep an eye out on the website in case they advertise in future.
The other question is it possible to still get invited for an interview after 2 months has passed after you've applied? Yes, they are still looking at the applications, and it does take a while for the NHLS to get back to people who have applied for the internship. So, if you've applied and haven't heard anything, they will still be contacting everyone. Is the NHLS internship the only body that one can use to get certification to become a medical scientist? No, I think Puseletso and maybe Drew, you've also touched on this, but other private labs also offer internships. Anything to add on that, Drew?
I see there's a question about which private labs offer. As far as I know, there is AMPATH, PathCare, and Lancet Labs that offer internships for medical scientists. But these usually are quite rare and they will advertise them, quite randomly. So you will have to be looking out quite often on their careers pages to see them. The NHLS is currently the largest employer of intern scientists.
Cabello, yes. Cabello, you can unmute and ask your question.
I don't know if anybody can hear me.
We can hear you.
Lovely. Thank you. I've asked these questions, I think, a couple of times already. Where I've had interview sessions, I think one with Lancet and one with Ampath. And in an interview, a panel literally asked me, not once, they asked me, what salary expectations do I have for a role? I think thus far it's been 2 roles. One was in clinical pathology as a learner technician, a learner technologist. And I'm just asking myself, how would you go about answering this question? And I wanted to find out what advice would you guys provide?
Puseletso, do you want to assist with that?
Hey, this is a difficult one, right? So it's for now, I think when you're kind of now qualified like us, you can straight up say your number. And it's either depending on how desperate you are for the job or not. You can either take it or leave it or negotiate or whatever. But at your point, I think it's good to always try and do some market research. I know it's not easy for people to tell you how much they earn, but you can kind of talk to people about some of the ranges, salary ranges, and just to get some advice, especially like for technicians and for technologists, right? And then you can either give them also the range, but I'm one to say this is what I expect. And then they will let me know if they are willing to negotiate or not. I don't know how other people like deal with it. And I've had a lot of questions as well, where I know there's one of the companies where they offer like it's way too little, and I'm not sure. So and if you are willing to negotiate, depending on how you speak to them, they are willing to negotiate to give you more. But if you, I think the trap sometimes is if they give you a lowest offer and you take it. So always kind of say your number. If you can't, you can say a range. If you can't say a range, you can also tell them to offer you whatever what they are budgeting for that position, and then you will take it from there. Because I always say that always negotiate, and then they will tell you if they've reached their maximum budget for that specific um, post or not. I don't know what other AIMS members can say about this.
Anele?
Now, personally, the best thing I do normally, I just ask, what is the budget for the specific role? And then you work around that. But for NHLS, what's nice about it is that they've got a pay scale, which is available on the internet. So you could work around that and give you a range, because there's a range for entry, semi-senior, and senior. But I think the best would be to say, rather tell me what the budget is for this role. And then also another tip is when you mention the numbers, make sure you say basic or net, because if you just say 40,000 Rand, there's also cost to company. So you're going to say 40,000 Rand, the cost to company, month end, you're going to get less than 40,000 Rand. So do your research around cost to company contributions, and all of that.
Okay, can I please also add now that Anile has said that one of the things that is good to do is that even if when they give you an offer, always ask for a dummy pay slip. So the dummy pay slip is going to add all the deductions that they're going to deduct from a salary, and it's going to add whatever additions that they're going to give you, maybe a skills levy or whatever. So ask for once you get the offer of whatever money, and then you are still not sure if you should take it or not, ask for a dummy pay slip. Then you can also negotiate based on what the dummy pay slip is saying.
Thank you. There's a question here. I think everyone can chip in. It says I've registered with the HPCSA under student medical scientist. Is it possible nor advisable to apply for a medical technologist? So I am going to try my best to answer this based on what I'm understanding here. You cannot apply as a medical technologist by yourself. You need to have done a medical technologist degree or a medical laboratory scientist degree, which is more or less the same or equivalent to each other. It's just they changed the name. You can only register under that if you've done that degree. The HPCSA medical student thing is if you are still busy with your BSc, but you can only apply for a medical technologist or a medical scientist after you've done an internship. Anyone else on the team to help me with that, or if I've answered that correctly?
Can I add something? So I know there's a form that the HPCSA has where you can apply to be a student as a BSc graduate. And I've seen this form and I've had people asking me about it. But the issue is, even if you register as a so-called student, you still need to complete training at some sort of institution. And the process, I think, is that you get your degree and your experience certified by the board for medical technology, and then you're allowed to write an exam to be a medical technologist. So that's it's a different path. But the problem is, I've heard that you have to pay a fee, and I think it's around 2,000 Rand just to apply to register as a student. And most times it will not get you anywhere because you still have to find somewhere to intern at. So if that's what you were referring to, I would advise against doing this because I think it is just preying on people to get money for those applications. Because, yeah, if you haven't studied medical technology, it'll be very difficult to get an internship, to get experience as a technologist, even if you're registered as a student. So it's better to go the route, although I know it is very competitive, to go this route as a medical scientist intern, where you register as an intern once you already have a place as an intern. I'm not sure if this helps.
Thanks, Drew. What I see everyone wants answered is when can we expect responses from NHLS if we applied in November 2024? So unfortunately, we don't have an answer for you. But Drew, during one of her presentations, she showed sort of like the timeline. So you can be hired by around May or June, even though it was advertised in November, because they go through a screening process and then they will interview candidates and then they will shortlist those candidates and then they will tell those that are successful to come start. And even then, they can say you will start in June or July. So we have no idea. It's just internal processes that handle all that within the NHS. Anyone else on the team wants to help with that?
I think it depends on the department. For instance, when Buse and I applied, we applied around November, December. We went for interviews in December, we started in Jan. So it literally depends on the specific departments when they start looking at the CVs and calling people for interviews. But as Drew said, and as Pew has mentioned, just be on the lookout. Look at your emails, also spam, just in case they've sent responses. But yeah, anything from now till June, July, I think, or even later.
Yeah.
Make sure you answer your phone because often the HR will call you just randomly to set up an interview. So just be aware of that.
I don't know how long we have, Drew, but I have this one. Good evening. What companies should we apply at to do an internship and acquire the HPCSA registration? So I'll answer that. That's the NHLS and other private labs like Drew has mentioned, Empath, Pathcare, and Lancet. Because I see that the NHLS requires you to already have the HPCSA registration. NHLS does not require an HPCSA registration before you start with your internship. You get to be registered as an intern with the HPCSA after you start your internship with the NHLS or MPAC or PACK or Lancet. That's when you start with the process of applying as an intern. And then you apply as a qualified medical scientist after you've completed the 2-year program. Any other ads on that?
No, I just want to answer there's a question about age restrictions. As far as I know, there is no age restrictions on the internship, just that the minimum requirement is an honors degree.
Okay, also there's another question. Umbali is asking, would you recommend taking another job offer or just wait for a response? Personally, I'd say if you get a job offer first, take it. And then if the internship comes, you can decide whether you want to resign from your job or continue. Unlike declining a job offer and then you don't get accepted in the internship. So it's a personal thing, but I would accept the job offer. And then if I do get accepted for the internship, maybe resign and then go do the internship.
I have to agree with Anneli as well.
All right, I think we should close the meeting because we are very over time. It will be 9 o'clock soon. So if we have not answered any big questions, please email us, or you can message us on LinkedIn, and any one of our members will respond. And we will also post our slides that we presented on today. Thank you so much, everyone, for attending, for taking the time to join us, and we hope that this was helpful to you.